We're going to be discussing for the next hour or so what a medical missionary might think about taking with them when they go out in the field. And years ago, when I first began to do this, I had a friend who was a medical missionary who kind of mentored me for a little while. And I said, I have no idea what I might need. And she said, well, I'll put you together a little kit. And so she put together a little kit for me. And this did okay for a while. We put all of our little herbs in here, and we called it Herbie. And all around the country, as we traveled from camp meetings or to wherever we would go, people would say, do you have Herbie with you? So-and-so is sick. And I began to think that people wanted Herbie and loved Herbie more than they did me, so I was wondering maybe I should just leave it home and see how I got reacted to. But you know, we outgrew Herbie because this was too small. We could get a few things in here, and that was fine. Now I throw my shaving cream and toothbrush and whatever in here. And we don't use Herbie for what he was intended for years ago. And we've got more things out here. As I've gotten a better grasp on what medical missionary evangelism is about and gained new skills, I began to develop more things to take along. Now, these are not all the things I would take. I do not have probably half of the things I might want to have here. But let's discuss some of the things that we would do. And we've got some of them here for visual aids that'll help to make this more stimulating to our minds. What are some things that you would want to have if you're going to be working in someone's home? You know, this is going to be a door-to-door work, and eventually we're going to get to discussing how to develop a door-to-door evangelistic work. And but for right now, we'll just assume that we're already doing that and already have those skills under our belt. What do we want to take? Are we going to take a little bag the size of that, or are we going to load up a maxi van, or how much can we logistically take within normal tolerances of what we can get our arms around? So let's discuss a little bit about that. We're going to have our class be interactive with us, and we've got a roving microphone here, and we're going to have questions. I encourage input because everybody has ideas that everybody else doesn't have. Some of the things that you obviously would want to have would be some things to help you with hydrotherapy. Now, these are some neat wool cloths that have been cut and sewn and hemmed up so that they don't ravel back out from use. In the hydrotherapy program that we were doing earlier, we used towels. Typically, you're going to be using the towels in the home. Everybody's got towels most of the time. But if they don't panic, have something to back you up. It's a lot nicer if you can use the towels in the home, because then you don't have to do the laundry for the whole thing. And especially if you're going to go from one home to the next, now you've got all soaking wet stuff. It's nicer for you to drop it all in their washing machine and turn it on before you leave, or have somebody there wash it for you. You have to learn kind of how to take care of yourself. It's a little bit of survival skill involved with this, because you can overwork yourself if you're going to be seeing too many people in your rounds or your routine. I'm talking about this in the sense of it being a door-to-door work. You understand how wonderful our message could be if people would understand that we were coming as ambassadors of Christ with healing in our wings granted from Him on high. Hydrotherapy is a very important aspect of this missionary service. It was not emphasized enough in my earlier ministry because I was only interested in the herbs, just the plants. I felt that I could do everything that needed to be done with a few plants, and I really was missing the boat because the hydrotherapy thing had just escaped my attention. I knew about it, but I really wasn't interested in it. I didn't emphasize it, and I didn't use it a lot. So don't forget some towels or some wool cloths. Many times you can find like old woolen blankets at thrift stores or whatever, If you get a hold of one really nice wool blanket at a thrift store for $2 or $3, maybe less, you can cut that up and you've got all the wool cloths that you need. In addition, you'll want some terry towel type things to put underneath so that you don't have to put that scratchy wool right down on top. It's nice to put something over the top to insulate that out. If you can't find that sort of thing, in the neighborhood that we used to live in, my wife just went to one of the local Amish stores, and they sell black wool for making their winter coats and capes and that type of thing. And we got those woolen yard goods really, really inexpensive. It was amazing, and she cut everything up out of that. So don't forget that you're going to want to be prepared for doing fomentations. If you're planning on doing a steam bath in the home, you may have to utilize what they have there. I would prefer to have about a 12-foot square or a 10-foot square piece of plastic, heavy mill plastic, with a hole cut out of the very dead center that you can pop their head through to put under whatever blanket that you're going to utilize in the home, so that you do have something for a steam bath insulator and to keep the steam from just evaporating right on through. You can store the heat in a lot easier that way. You'll notice that that little plastic will fold up very flat and not take up hardly any space in your medical missionary kit. You may wish to purchase a very small hot plate that you can take with you. That's great if you have electricity where you're going. Sometimes there isn't electricity where you're going, and then you're going to have to do some additional improvisation. I do not recommend doing the Russian steam bath in a chair with a flame source underneath. You are taking an incredible risk, and you could roast somebody pretty well. So you may want to have to just take that person out of that area. Or you may want to just do the fever treatment, the one that you can do on a table or on a bed with just the hot packs and the hot foot bath. But if you're going to do a hot foot bath, you'll want something for the hot foot bath to be done in. You want to place their feet in something. So I would recommend possibly having something like this. You'll say, but oh, that takes up so much space. Well, not really. You can put other things in it, and it doesn't take up very much space. All these little things can be packed away very neatly in the trunk of your car. If you live out where I do, you'll probably want to put these inside of a trash bag and put a twisty on it, because I don't care how clean your car is on the dusty roads where you have to travel, that stuff gets into everything. It just seeps on in. So don't forget, you'll want to have your hydrotherapy pack in this, because there's been places that I've been where we couldn't find something other than maybe an old feed bucket or a dog dish or whatever, and people are a little reluctant to put their feet into their dog's dish sometimes, or something the chickens are pecking out of it in the yard. Before you do any type of a hydrotherapy treatment, you remember we're talking about taking their pulse. This doesn't take up a whole lot of space on your arm. But don't forget that you're going to need a watch with a second hand on to be taking pulses with. If you want to go modern and go digital and get one that has the digital counter, that's fine, I don't care. I like the old-fashioned second hand because I don't have to think. I can watch it go from 9 to 12 and know that I can count and multiply by 4, and I guess old habits die pretty hard. One of the things that you'll want to learn how to do, and that is to take a stethoscope and listen to lungs, because someone is coughing and you'll say, well, this guy's just got a bronchitis, I'll just help him out with it. Well, maybe he has pneumonia. You need to be able to know what you're dealing with. You can't help someone through a problem if you have no idea what that problem is. And so by recognizing where in the lungs the sounds are coming from and the different sounds made in a lung, you'll know the difference in what you're dealing with. Maybe they just have a little bit of a dry cough and it's coming from right up on top here, or maybe they've got these really bad wheezes and rattles that are coming from way down. You'll want to know the difference. Also, I like to have the stethoscope before you do the fever treatment so that you can listen to the heart and know that you've got a nice integrity to the rhythm of the beat, that it's steady. You've got the same good heart tones all the way along. You're not getting an erratic beat or some strange you start hearing valves clicking in the heart. You say, I don't know if I want to put this guy in hot water or not. This is very valuable, and it's something that's good to learn how to use. If you don't know how to use one of these, I'll be happy to help you to some extent with that. The problem that you have is, some of you here would like to learn that, but we don't have any sick people for demonstration purposes to find the difference on. So it's good if you can perhaps find a physician or a nurse who will maybe mentor you or give you a little bit of a temporary apprenticeship or something and give you a little bit of exposure to that. Sometimes schools of nursing have libraries in which they have cassette tapes that you can check out or purchase, that you can hear a whole repertoire of lung tones and heart tones. And those are very valuable tools. So don't ignore that resource. It's worth looking into. I have done that years ago, and it was really valuable information. This is a blood pressure cuff in layman's terms. It's a sphygmometer in medical terms. Most people don't like to use that word because it's such a tongue twister. I have to really think about it, or I say something other than what I was supposed to say. Taking people's blood pressure can be a very good tool. It's not an invasive practice. People are not going to accuse you of practicing medicine because you take their blood pressure. The little pink ladies from the local hospital do this routine, quite frequently down at the county fair or number of these places. And it'll be fine for you to do that type of thing. And it's going to provide you with some good information. You take somebody's blood pressure and it's sky high, I wouldn't advise putting them in a Russian steam bath, and I wouldn't advise doing a fever treatment on somebody like that. And perhaps they are not even aware that they have high blood pressure. I had a friend one time who had high blood pressure, was not aware of it, and it destroyed his kidneys. And he ended up having to have a kidney transplant. If someone would have found that, they would have saved him from all of that misery. So I think it would be well worth your time to learn how. We'll be happy to teach you that here. Those of you who are at home on a video, I can't teach you over the tape very easily because I need to have your ears on the stethoscope so you get to hear. Find someone in your church or in your locality who is a nurse or a doctor who's willing to teach you. It's very easy to learn. Don't be intimidated by it at all. But it's a good tool to have in your kit. Well, we talked about herbs. Don't we want to have some herbs in our kit? Well, let's talk about what kind of herbs and in what form so we know what to take. Powdered herbs will be probably your primary source of herbs that you'll take along, because you can do any one of a number of things with these herbs in the home. If you take them in their just cut and sifted form, or in the form that you find them out in the woods, they're going to be difficult for preparation purposes. See, this is very, very rough. Let's say that I wanted to make some capsules. I'm at one of my neighbors' home, and they're coughing, and they're coughing, and they're coughing, and I want to leave them with some capsules for a respiratory inflammation. Well, I'm not going to get all this rough stuff into a capsule. So for that reason, I like to get as much stuff powdered up to put in my kit before I take it. It makes it more versatile to work with. The same thing would go for this bark. It's shredded. What am I going to do with it? It's great if I'm just going to tell them to make a tea out of this. That's fine. But if I want to put it in capsules, perhaps they can't get a lot of tea down or something like that. Capsules might work a whole lot better. Let's talk about capsules. Get yourself a little Ziploc snack bag. I like these little snack bags, probably the best for this type of thing, because I don't have to take a whole lot in, and I don't have a whole big floppy bag with a little bit of nothing in the bottom of it. So I like these little snack bags. And I'll put 100 or 2 capsules, empty capsules in here, so that I can have them along, so that I can encapsulate just about anything. Now here's our little Cap-'em Quick machine. We demonstrated on our last program using this, how to make our capsules. This really will speed you up. Let's say you want to leave them with 50 capsules. Instead of spending 15 minutes or whatever trying to pop these all in one at a time, use your little machine. You'll be out of there in just a couple of minutes. You'll be done making the capsules. Because remember, your time is valuable as a medical missionary. You have a lot of people to save from the lake of fire before Jesus comes, and you can't, it's not good stewardship of time piddling around making one little capsule after the other. Do things as quickly and time effectively as you can. And of course, most of us have families we need to get back to, and if we can save 10 minutes every day for 5 days, we've saved virtually an hour. I'll put some of these things aside as we go on so that they're kind of out of my way and out of our sight. What type of herbs should we take? We talked about the forms and the delivery system in a capsule, but what type of herbs do we want to take? Well, you should take some herbs that will work with the immune system. And you can either take them individually, or you can take them all mixed up. I like to take some of these in a tincture form. This is called a super immune drop that we make. It's one of my brainstorms from a long time ago. And it's a blend of a lot of the herbs that work with the immune system. Well, let's refresh our memories. What kind of things work with the immune system? Okay, golden seal works with the immune system. Echinacea works with the immune system. Osha root, I showed you a little bit of that yesterday, although we didn't discuss it a lot. That works with the immune system. Garlic works with the immune system. Astragalus works with the immune system. There's quite a number of these things that'll work with the immune system. So when you go through your study notes, maybe you take a little yellow marker and color code your notes. So like yellow is all immune system, and red is all hormone related, and blue is like a refrigerant that cools you down. Color code your things so that you say, man, I'm looking for a diuretic. Well, maybe that's yellow or brown or whatever. Color code your notes so that you don't have to really struggle with this. Make you be able to work much faster. I know all about maybe 150 herbs or so, but to try and just always keep them always right in my mind with ready access. Sometimes I need something to jog my memory. So your immune system herbs are the ones, because if you're in the home and somebody's, you can tell right off the bat, this guy really needs sort of a pick-me-up for his immune system, because he's going, he either needs to get well or get sick, one or the other, so we can deal with him. Those would be some real handy things to have. And I like it in tincture form, but I also like to have some of the individual little bags of herbs along in case I want to increase a particular level of one particular herb. What are some other things that you might want to have? Well, we've talked about the immune system. What about some diuretics? Not a bad idea to have some of your diuretic herbs like your dandelion leaf, your shepherd's purse. Those would be good to have. Sometimes you work with some of these elderly patients and their ankles are all swollen up, and you can tell that they're fighting with perhaps some edema, indicative of perhaps some congestive heart failure somewhere along the way there. You can make their life a lot easier by helping get rid of some of that excess pressure. You can learn to detect that by pushing in on their skin and seeing how fast it pops back out again. I see your head shaking up and down. Most of you are aware of that. Those would be handy to have. How about somebody who has some pain? What do we want to do about pain? I make up a mixture of herbs that I call for a pain tincture. Remember, the nervines are the herbs that we want to work with for pain. You're talking about like valerian and skullcap, some of those herbs for the pain. In addition to that, you'll want some herbs for inflammation. You know, perhaps somebody has a sprain or a strain or an arthritis ache or something like that. Some anti-inflammatory herbs, you know, like your white willow would be one that you might consider taking along. Maybe some yucca, that might be one that you might want to use. Yucca is a powerful anti-inflammatory, but yet is very gentle on the system. And I forgot to put that one on the lecture notes yesterday too, didn't I? Oh dear, yucca. It's from the root of the yucca plant. It works very, very well. I notice in veterinary medicine we're feeding this stuff like crazy to racehorses to keep them on the track. It works really, really well. And it's natural and doesn't burn the horse up. You know, somebody's got $1 million horse. They're looking for natural remedies. They don't want their veterinarian to burn their assets up. What other things we might run into out there? Somebody has a bad fever. How about a refrigerant herb? What are a couple of refrigerants that we talked about yesterday? Raspberry. Okay. Watermelon juice. Maybe that's not in season. We're in trouble. We can use the salicylates out of the white willow again to help bring down fevers as well. So you've killed two rocks with one bird with that herb. I try to do that sometimes to cut down on how much that I have in there as I think of crossover herbs that'll help me in more than one direction. A diaphoretic herb like yarrow would be really a good thing to have. Somebody needs to get a good sweat while you're doing a fever treatment or one of those types of things. That would be a really nice herb to have. Some antispasmodics would be really excellent to have. Now, there's two categories of antispasmodics. One for the GI tract, like your catnip or your peppermint. But what about for muscle pains? What would we use for some muscle spasms? Remember like the black cohosh and the valerian, some of the antispasmodics, maybe the lobelia. Let's take along some herbs for coughs, especially in the wintertime. You're always running into people who say, I can't even sleep at night. I'm just coughing my fool head off. Hack, 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 hack. You know, when somebody starts doing that in my family, I say, either you do something about it or I'm going to do something about it because I can't stand to listen to this anymore. If I wanted a dog in the house, I'd bring Shasta in. You know, it's bark, bark, bark. There are some really good herbs for healing that up. You know, your comfrey and your goldenrod, your mullein, some of those healing herbs. Maybe a little bit of a lobelia to take along to help the antispasmodic so that you're not having all the bronchial spasms as well. Help heal and soothe that area. What other things do you encounter in homes when you go out there? Sore throats? You run into sore throats? Might not be a bad idea to have a small piece of wool and a small piece of cotton to do that little sore throat routine for them. Tell them you'll pick it up someday when they're okay again. Most of the times you can find a handkerchief and a wool sock in the home, but not always. So have one in, put one in your hydrotherapy type pack. I find that a little bit of salt and a little bit of cayenne pepper goes a long ways towards helping people get rid of a sore throat. Some people are a little bit afraid of gargling with salt and cayenne pepper, but maybe you're going to have to do it and show them that it's not going to kill you. But it's very soothing, makes the sore throat go away, makes them feel a lot better, takes the pain out.
I gargle just with cayenne pepper without the salt.
Okay, there's a man braver than we are. He uses the cayenne without the salt. I love it. I just really have to keep myself from swallowing it because I like the flavor of it. Those are some of the herbs that we might want to work with. I like to always think that a medical missionary would have something for an asthmatic who is in a distress. It's not that uncommon to run into somebody who's having an asthma attack. And you can make a antispasmodic tincture out of some things like skunk cabbage and lobelia, a little bit of black cohosh, tiny bit of valerian. Put those things all together in a tincture. It works wonderfully towards stopping the spasms that you get in the bronchial spasms, and you can help somebody breathe free again within a minute or two, whereas before they would actually be in really some serious distress. If you've got your hydrotherapy packs, you can put a squirt of that tincture under their tongue and start doing some local fomentations over the upper chest area and help relieve some of that as well. Get that heat on there right away. Those are some things we might have. Of course, we want some charcoal, don't you? Absolutely. You can't have a medical missionary pack without at least 4 ounces of charcoal. I mean, that's the minimum. I like to take it in the tablet forms in case you run into children who will not take it any other way. But, this has got sugar and microcrystalline cellulose and sodium and magnesium stearate and some other junk in there. But it's better than not getting it down a child. And sometimes when you travel a lot, I tend to take a few in a plastic bag inside of my suit jacket when I'm flying in case I get a hold of some food that I wish I hadn't. I order vegetarian, but sometimes even these vegetarian meals on airplanes upset your stomach somewhat. So I like that. That's okay to travel with. But if you're going to be making poultices, or if you're going to be putting this in people who have upset stomachs or whatever, you want a fairly decent quantity of this. And so I like these little 4-ounce cans with a plastic lid on. You can put it in a little plastic jar if you want as well. You just want to keep it airtight because it will absorb humidity and air pollution and whatever else and eventually get to where it's not a whole lot of any good to you. If it gets that way, just pour it out in a pan, put it in the oven, bake it at a high temperature for a while, and it will be about 95% of what it was again in a short amount of time. Well, if we're going to be making poultices, we need something to make poultices and compresses with. Again, I like to take some of this underpadding material because it is so handy to work with. It doesn't take up a lot of space, and if I just use a piece of toilet paper or a piece of paper towel or an old piece of sheet or whatever, people kind of think you're a little bit woodsy. But if you bring out something, sort of high-tech like this, and you make a really nice, neat little package, they're kind of impressed with you. I mean, this guy's kind of professional in his approach. And so you need the scissors if you're going to be cutting it up because you're not always going to find the scissors. So you want a nice, good, sharp pair of scissors. And they don't have to be big. I normally just take a little pair of child's scissors, these little alloy aluminum or whatever, Fiskars or whatever, and just enough that you can make your little patches out of. If you're going to be doing a lot of poulticing, you really should have some flaxseed meal in your bag because it makes your poultices have a lot nicer consistency and a lot easier to work with, and it also makes the effectiveness of your charcoal enhanced to some degree. And as time goes on, you're going to be able to figure out how much of which thing. I mean, how big a quantity. Do I want to take an ounce of this and an ounce of that, or do I want a pound of this or a pound of that? What do I really want to take? I would say make up some salves for skin irritations before you go. It's not a bad idea if you want to take some, let's say, some olive oil or some coconut oil or some paraffin or some cocoa butter or whatever along, and if you want to make a salve, a particular salve out of some of the herbs that you have right in the home, that's fine to have those things along. But think about what types of things that you normally run into that you might want some salves for. You may come up with people who have lots of psoriasis or lots of eczema or dermatitis or whatever. Well, then go ahead and make yourself up a good skin cream with marigold and chickweed, and make it up in advance. Take a little jar along, make certain that you've put enough vitamin E oil in it to keep it from going rancid, and keep your little medical missionary supplies in a cool place. Now in the summertime, don't leave all this stuff in your trunk and bake it to death. You'll ruin your herbs, you'll ruin your salves, everything will go rancid and wacky on you. So I would take the stuff in. It's nice if you can have it like in some plastic bins with folding lids, or 2 Goodwill suitcases that don't look too shabby. You really don't want ratty looking stuff to go to somebody's house with. You want to look somewhat professional with what you do. Suitcases are fine, but if they've got Las Vegas or bust or whatever scrawled across them, you may not want to utilize that. Sometimes you can actually find some really nice looking pieces of luggage for like $2 a piece in a thrift store, but whatever. There's Rubbermaid makes some neat little folding boxes out of rubber and plastic too. Whatever you think is going to work for you, but make it so you can get it in and out of your vehicle so that you can store your stuff in a cool place, because if you leave it in your trunk, take it out in the sun, you're going to ruin all of the stuff that you want to work with. Of course, you want a small stapler along so that it makes it easier for making your poultices. Can't go anywhere without a stapler, can you, Paul? Paul let us use that. I guess he's had it for almost 20 years. A little bit of plastic silverware is nice to have in your kit, because if you're going to be stirring up some poultice material, what are you going to do it with besides your fingers? I tend to lick my fingers when I work with stuff, and so there's some of this I don't want to put in my mouth. So it's not a bad idea to have some paper toweling or wet ones or wet wipes or whatever for the baby, because that really makes it nice for cleaning up messes, because they're already pre-moistened and they hold together nice. I like to have some of those along. You want some bandaging material, like some gauze 4x4 strips. These will be really, really nice for you, because you can place some salve on that, put it on the patient's wound, wrap that up. If you want to take surgical tape, I think surgical tape can be of a real benefit, a roll or 2 of that along. Of course, you've already got your little scissors for poultices. Those are a crossover again, you can utilize those. I try not to tape a lot of things on people, especially people who have hairy arms or hairy legs or that type of thing, because then they disappreciate you when they go to take it back off again. So I like to find ways of holding it on, like with elastic bandages or something, where it comes on and off easy. The only thing is, you don't want to forget who you put this on, because if you've ever purchased one of these in recent times, they want an arm and a leg for one of these anymore. It used to be like $1.50, and I think the last one I saw was like $6.99 in a pharmacy. It's incredible. Flashlight. You want to look in somebody's throat, and they say, "I think I got a sore throat." Well, you want to turn your light on and look down in there and see, do you really have a sore throat? If you see yellowy, pussy stuff all over in there, you got a pretty good idea they got strep throat, and maybe they're going to need to deal with some both internal and external topical applications, like maybe they want to gargle with some salt water, some cayenne, and what might kill strep? Well, let's look back in our antibiotic herbs again and see. There's some of these that also you might want to color code for antiseptics that will kill germs on contact. Perhaps your hyssop might be one of the herbs that you might put in that gargle. I like some hydrogen peroxide, because good old hydrogen peroxide is inexpensive and it kills strep germs on contact. I have really cleaned up strep many times with hydrogen peroxide. You gargle with, you can either water it down. I like to just take the 3% from the pharmacy and just take the bottle and gargle with it, and it will wipe it out.
That was what?
Hydrogen peroxide, from the pharmacy. It's inexpensive. This is also good for getting a better look at wounds sometimes. Gives you a much better appreciation for what may or may not be in someone's eye from a first aid point of view. You're also going to want to be able to do some massage work while you're out there. There's nothing like a good massage to make a friend. Many times I've run into people who are going, "Oh man, this is really bugging me. Hurts, man." And you see they're holding their neck, like this, and you say, "Well, sit down here. Sit on a chair." And we're going to be showing you how to do what I call chair massage. Chair massage is great. You can do most of the massage work right with the patient sitting in a chair with a t-shirt on. But If you got a couple of towels and maybe you find a blanket in there, you lay them out on a kitchen table or on a bed or on a floor or wherever. Just don't get them chilled if you're going to put them on a floor. Keep them covered. You're going to need some oil to do the massage with. Well, what kind of oil do you want to use? Now, this is an old dial soap thing, but I don't like taking the lids on and lids off and the lids on and lids off and getting it all over the place. This with the little pump thing is really neat. I can just squirt it in my hand and warm it up and go right to work, and I don't have to be playing with lids. And really makes things easier, especially for lazier type people. You can't be too lazy and be a real medical missionary because you're self-sacrificing if you're going to be a medical missionary. But that's really of a benefit. You can use vegetable oil. If you're in the home and you ran out and they've got Mazola or Wesson or whatever, you can use it. You can use mineral oil. You could use olive oil. Coconut oil really is probably the nicest one. Almond oil is the king, but when it stains a sheet, it turns rancid. And it does stain. It's very difficult to get out. The nicest thing about it is you can put a little bit on and it doesn't absorb in, and you can rub and rub and rub and rub and rub without reapplication. That's great. But, if you're going to be staining their sheet or your sheet, one or the other, it's going to get a stink about it eventually. And for that reason, you might want to avoid that. The coconut oil is probably the next best alternative. It doesn't absorb in too readily, and it has kind of a nice flavor. Kind of smells like cookies or reminds you of being on the beach or something. Usually it brings back good memories to most people, and they feel pretty happy. It kind of elevates their mood while they're there. As soon as somebody starts rubbing my back with that, I don't know, I hear seagulls for some reason or other. Maybe I have never gotten a good sunburn at the ocean, I don't know. I like to take some things along for nausea. You can really make a friend out of somebody who's throwing up their toenails and socks if you can stop their nausea. This is just peach leaves in a tincture. Works dramatic. I mean, it's a miracle. I've seen so many times where people were just in agony, dry heaves. I mean, we had a neighbor one night. I mean, they were up, the whole family's up just all night long. And they called us about 6 o'clock in the morning. Can you help us? And so we didn't want the bug, so we took them down some peach leaves, and we said, we're going to leave it on the hood of your car, and we're going to get in our car and drive away, and you can come out and get it after we're gone. And so we did that, and they called us on the phone and said, how do we make it? And we told them what to do with it. And especially the husband of the family, the father, he was so sick. And the wife said within about 15 minutes, he was making the tea. He no longer was throwing up, and he went to bed and went to sleep and slept for like 6 hours. And she said, what a blessing. I mean, really makes some good friendships with people to be able to help them in that respect. And so for that reason, I like to take a little bit of that tincture because it works so fast. Okay, we got a comment out of there.
On the peach leaf tincture, you said also that you could just do like peach leaf tea?
You can make an infusion out of the peach leaf as well, but it's going to take you at least 20 minutes to get the water hot and put it in and let it steep and cool back down. And if you've got somebody who's running around going, this is a lot faster. I mean, okay. 9 times out of 10, they're going to not even throw up, and you're going to really make a friend. You'll become a hero.
Okay, thank you.
They'll view you as a naturalistic, intellectual genius. Question in the back.
Do you put the tincture on their tongue?
Put it right under their tongue. That particular tissue, it will absorb more than any other tissue that we can get access to in a short order. And it's called sublingual absorption, and it will absorb almost immediately. And you will very quickly begin to feel a lot better. Now, there are some instances where someone has been poisoned and you don't want to artificially quell the nausea because whatever that is in there, may need to come out. and maybe you would be better off using your charcoal instead. You'll have to understand. But if it's, you've got some poor person who's been throwing up all night, and you knock on the door at 8 o'clock in the morning, and they come to the door with a bucket in one hand and a bathrobe clutched around them like this, and they're, lavender and green, you'll know what to go for. The charcoal's not going to do the trick like the peach leaves will at all. Now, what if you forget something? What if you're in the home and say, man, I sure wish I could remember what to do for you? You probably ought to take along a little book that help you remember, kind of prod your memory along a little bit. This is one of the better books for that. It's small, it's broad-based, it fits in the pocket of your coat, or it'll stay in your little medical missionary pack real easy. You're not worried about field identification in somebody's house. You just don't want to forget something that maybe you ought to know. There's also some pretty good recipes in here and there. This is the Back to Eden book by Jethro Kloss. I'll set it up here and give the camera people an opportunity to take a zoom in on that and a close-up. That's the revised and updated edition. And people are impressed with Jethro Kloss. It's sold in bookstores around the world. The heathen think it's a great book. I think it's a pretty good book. It doesn't take the place of an education in herbal medicine because he speaks in such general terms that it's difficult for you to get specific from this book. But many times I have used this book because I just couldn't think of what it was I wanted to think of. And when I saw it in there, oh yeah, I saw the name I needed. I already knew how to use that because he didn't tell me that, but he did remind me what to use. I'm going to get everything out of the way here. You need some tracts. Some medical missionary tracts on the 8 laws of health. Trusting in the divine power, proper diet, abstemiousness, rest, pure air, sunlight, exercise, water. When these people are homesick and you just made them feel a little bit better, you got a captive audience. They're not going to take this and crumple it up and say, oh, that was, throw it away, wish they wouldn't knock on my door. Totally different relationship between you and them now. They're going to be happy to take something from you. It's not a big book, it's not a big magazine, it's light, it's easy. They're not going to be intimidated. They say, oh, that's just a couple of pages. I could probably get through that. Now you got something to talk about next time you show up. Stop back by next week, say, hey, or next 2 or 3 days. How are you feeling now? You okay? Yeah, I'm doing fine. Did you get a chance to read that little tract on pure air that I left by? Yeah, I learned something there. And now you got something to talk about. Get your foot in the door. It's a whole lot better than, you've heard of the salesman who sticks his foot in the door so they can't close the door so he gets the rest of his spiel in there. I don't know. I never saw anybody who got very far doing that. Do not leave this out of your pack. If you're going to be a medical missionary evangelist, how are you going to work without your Bible? Man, you got a captive audience right now. You better not leave behind the most important thing. This is it. This is the most important thing for a medical missionary evangelist to take. And don't forget that last word. You're not just a medical missionary. You're a medical missionary evangelist. We're not making healthy sinners. We're making Christians out of sinners. And we're using the health to make the transition. I have caught myself numerous occasions not closing the deal, not putting a hook in the bait, by just helping people feel better and missing the opportunity. It's really, really a wasted attempt. It's like putting $15,000 worth of advertising into a evangelistic series, preaching the sermons and never ever having an altar call or asking for people who want to have Bible studies or asking anybody if they want to be baptized. Hope you enjoyed the show. Get out of here. That'd be the equivalency. Don't forget your Bible. And friends, don't forget to read this thing every day.
Amen.
You have to pray. You have to take angels with you. I know you can't put angels in your pack. But if you're going to go to that door without the Holy Spirit and without the angels, you're trying to fight the battle all by yourself, and it's going to be too big for you. But if you have studied for an hour every morning, if you have prayed every morning diligently, and I'm not talking about, dear Jesus, help me not to be a naughty boy today, thanks, goodbye. I'm talking about wrestling on your knees with the Lord for the power and the grace to overcome who and what we are, wretched as we are. He will use us if we'll utilize His power to become different than what we are. And we don't get that with tame prayers. We've got to go to the throne of grace and do like Jacob, wrestle with the Lord for victory and the power to overcome. Study in prayer. Take those angels, take that Holy Spirit with you. You can become victorious, not only in your own life, but as a soul winner. You know, there's a passage in Daniel where it talks about shining. They shall teach them or whatever. I forget the verse. I looked that up one day. Shine as the stars of the morning. I think it's in Daniel 12. You know what the Spirit of Prophecy says about that? It says the shinings from all the stars in their crowns. Friends, as we save other people, we'll have a reward in heaven like you'll never understand. Not down here. Don't ever feel that as a medical missionary that you're going to become wealthy. I've never seen a wealthy medical missionary. And I don't want to discourage those of you who are watching the tape at home. All the medical missionaries that I have seen have been having to struggle for it. But you know what? That's the only way we're going to make heaven. If it's handed to us, we're not going to get in the door. We're going to have to struggle. It's a warfare. It's a sacrifice. Jesus never had anything but the clothes on his back and the meal that he just had. That's all he had while he was here. And we've really got it a lot better off because I know where my next meal's coming from. I know I'm going to go in the other room here in about 15 minutes and eat a nice meal. Jesus never knew that. Other than in his infinite wisdom, because of being partially divine, God could reveal things to him. But his disciples were then called to do the very same thing. They went out without a whole lot. So don't be hesitant to go out and be a medical missionary because you say, well, I don't have a nice car and I don't have nice clothes and I don't have all the equipment I want. You've got to start someplace and start where you're at. Are there any questions or any suggestions that we might have here before we wind up? Looks like we need to pass the microphone around.
With the hydrotherapy and the steam bath, what if they have a vaporizer in the home? Would that work?
Well, it's going to depend on the vaporizer. The old-time vaporizers actually made steam. And once in a while you can find one in a thrift store. My mother found me one in a thrift store for 45 cents in Pasco here about 6 months ago. And it was a real little boiler. It made some steam. The new ones that we have today blow a little bit of cold vapor. And it's not really all that therapeutic. All it does is add humidity. And sometimes if the phlegm is thick, it will loosen it up and make it less viscous in the lung. But that's about all it's going to do. They'd be better off to turn the shower on hot and stick their head in there. Okay, question?
I had a question on the, to ascertain the temperature of the water you're going to use for foot baths and stuff. Should we have some type of a thermometer?
That's a really good suggestion. I have tended to use this thermometer because the Lord has blessed me with being able to gauge things pretty well. I can look at a 2x4 and tell you within an inch or so of how long it is, and I can tell you how wide something is and how tall something is and how hot something is or how cold something is, but it's not terribly accurate, and most people don't have that peculiar artistic talent. So if you've got a thermometer, and this is going to take you a little bit of shopping to find, because I have found that they are hard to find. They either start at about 140 degrees or 130 degrees, or they're down on the other end or something. It's hard to find one that goes from like 80 to 130, where your range is going to want to be, because you're going to want temperatures from like 104, 105 to 114 is the ranges in hydrotherapy. So you'll have to shop a little bit to find those, but they are out there. I have seen them. Okay, one more.
It's very common that children will have an earache. What would you do, or what can we do for them?
Oh, you just helped me remember one very important thing to take along, and that is an oil infusion of garlic. Garlic oil. Now, if you don't have time to make this yourself, you can go to a discount store like I'm not going to give any plugs for any, but there are places that have natural products for sale. And they have these little gelatin jelly tabs or whatever they call that have garlic oil in them. And you can poke a hole in those with a pin and squirt that in the ear, and that works really pretty well too. Or you can buy just the oil by itself. That, an earache is a very common one. I'm glad you brought that up. That's very, very common. And you can become a hero with both Junior and Mama if you help that earache out. You'll need a little bit of cotton in your pack in order to put something behind that to keep it from running back out again as well. One more thing that I did not cover very well, and that would be an antibiotic ointment of some kind. Like maybe you'd take some lavender oil and some mullein flowers and make an ointment of some sort out of that. That would be a nice topical application, and I think you'd do quite well with that one. Okay, we've got a question in the back, if we can send the microphone back.
Rob, I wanted to ask about the first aid part of this, like Band-Aids that you'd have with you in case to hold on, in case you didn't have an ace bandage, that a Band-Aid would be available.
Okay, a first aid kit along in conjunction with is really a good idea, and we have printed one of those up, and I don't know if that one is in here today. We had it faxed over this morning. If I could get my hands on that, we'd put it on the overhead, and the people at home would be able to take a look at that. Did that not make it from the office? Okay. Communicate, somebody fumbled our ball again. We'll break and get that on the tape later, and I'll hand that out here in the class. Take along you've already got your surgical tape and your gauze and that type of thing. Some Band-Aids and some cotton. Some of those things are pretty well in order. Anything else? Okay, can we hand the microphone back into the second row, please?
For an allergic reaction.
Okay, that's another one. There's a lot of different kind of allergic reactions, but let's take two scenarios, the two most common. The first one is if someone has eaten something or ingested something that's going to cause an allergy. I have found that echinacea and licorice, 2 parts licorice, 1 part echinacea. You want to make a tincture out of this, or you can take it in a powder or capsules, however you choose to do this. This will, because it has natural steroids and will deal with reactions, I feel that if you take sufficient amounts of it, it's more powerful than Benadryl or any of these other type of things. 2 parts licorice and 1 part echinacea. They take that internally, and that will be an excellent thing to work on an internal reaction of some sort, whether it's been a food allergy or they've taken a medication or that type of thing. I also like to utilize this in case someone's been stung by a bee or bitten by an insect that they're allergic to. It will really help stop some of that allergy rush that people get. And don't forget internal, external, inside, outside. Work on this thing with if it's a sting or a bite or whatever it is, get a poultice on that thing as fast as you can as well. That's an excellent thing to remember to put in the package, because we do run into that very frequently. There's a lot of people who are allergic to things. When I was a little kid, An allergy I almost thought was a myth. I remember being about 5 years of age and telling my parents, I really think that allergies are mythological. I don't think they exist because I've only heard about them, but I've never actually met anyone who had one. And I've heard doctors say, well, I think he has an allergy. Well, they thought I had an allergy when I had a tumor behind my eye, and so I began to doubt the infinite wisdom of the surgeons to some extent relative to allergies. But today, because of environmental things, because we're so far from creation, it's hard to find somebody who doesn't have some sort of an allergy. Any more? One more, if we can send the mic back into the second row.
We may encounter somebody that may believe is having a heart attack. What can we do while the paramedics come or while we take him to a hospital?
Well, the typical standby for a heart attack is cayenne. It's a very easy to use thing. It's simple. You're probably going to want to do that one in an encapsulated form because it's so hot going down. You can tincture it, and it would be absorbed quicker. But if you're going to do that, you're going to have to watch out because it's just hot enough that some people will their throat will close off and they'll stop breathing on you because they'll start going because of the heat, because of how it jangles the nerves in the throat. So I would think it would be better to take some cayenne and have it already in capsules. Don't have it in a bag and have to diddle around with your nervous fingers trying to get it in there and not be able to get your capsule shut.
I know of people who have, in the process of a heart attack, simply put a pinch of it under the tongue and it'll hit them immediately and it'll stop that heart attack right away.
That will work. And if you didn't have a capsule, that'd be fine. But I run into a lot of people who you give them something hot in the mouth and immediately they say they can't breathe. Some people have, I don't know, real hyperactive gag reflexes or what the deal is, but their throat just... I remember one time eating a jalapeno pepper from a can that had Mexican writing all over it. And I love hot food, and I didn't think there was anything that was too hot. That was 20 years ago before the health message hit me, and so I started to grab that, and this boy named Manuel said, you gringos can't eat those. And I said, there's nothing too hot for me. He said, I warned you. And I bit into one of those and started to swallow it, and I couldn't breathe. It was that hot. Anything else? We're just about down to the wire on our time for this tape. If not, we'll reserve the rest of this tape. We're going to put our suggested natural first aid kit on the overhead, and we'll put that on the tape, and people can copy that off at home. Here it is. This is our natural first aid kit. This was something that was compiled by my oldest daughter when she was only 14. Now understand, folks, this is a simple art. Even children can do these types of things. The checklist includes tweezers, because you're going to want to be able to pull out some slivers or get at some smaller things. You'll want some gauze in case you want to have to work with some wounds, something to put your salves on or sop up blood from bleeding. An ACE wrap or ACE bandage so that you can keep your poultices and compresses on, or if you have a strain or a sprain, you could apply it in that way. Some small scissors so that you can cut up your bandages and poultice materials. Cotton balls for cleansing the wounds. Hydrogen peroxide, 3%. You can purchase that at any kind of pharmacy, grocery store, discount store. A small mirror will come in handy so that if you happen to be all by yourself and you want to see what's in your eye, you can take a good look at it. Sometimes you can see parts of your body that you can't see any other way so that you can work on them. Some herbal liniment, a small bottle of that. You want to study on how to make some liniment. Some of the more pungent herbs that have camphor and that type of thing, along with a little bit of alcohol, can rub in and take care of some of the pain from strains and sprains. Charcoal powder. A small kit would have 4 ounces up to 12 ounces maximum, so you can really do some heavy poultice work. Or you'd have it in case maybe someone would have ingested some sort of a poison. Your white willow capsules, of course, for headache or inflammation. case if you don't have that, you might be able to substitute yucca in place of that. Peach leaves. Now you can have either 2 ounces of herb, a dried herb, or perhaps maybe you want to use some tincture in place of that. You're going to be using that in case of nausea. That's a very common thing that people deal with, is dealing with nausea. Vitamin E oil in the little jelly capsules, or you can buy it in like 1 and 2 ounce little squirt bottles. This is excellent for application to burns. Charcoal tablets, because little children tend to be very difficult in dealing with the charcoal powder sometimes. Witch hazel. You can buy that either as the powdered herb and make your own infusion, or to possibly maybe purchase that from a pharmacy because it's stabilized so that it's not going to spoil on you. It's a good astringent. It's a good astringent wash in case you have something itchy. Marigold oil. Now, you don't squeeze oil out of a marigold. It's an infused oil made from marigold. It's made from the entire plant. It's tremendous in dealing with things like rashes and all those kinds of itchy factors. Aloe vera. And you can deal with your aloe vera in a number of ways. You can purchase aloe vera gel from commercial sources. It works quite well. And it's stabilized so that it's not going to spoil on you. Otherwise, you're going to have to take a plant along. You're going to be using that in case of burns. It's excellent for sunburns. You can use it to apply to wounds. Clove oil. I think most of the old timers will recognize clove oil for working with toothaches or pain in the gum area or other oral sores. Catnip. A couple ounces of catnip would be advisable to have. You can. It's a muscle relaxant. It's an antispasmodic. It's great for gastric upset or stomach cramps. It also is good in case you have an infant with colic. Immune boosting herbs. Take 100 capsules of that. You're running into somebody, or you could get this in a tincture. Study through your notes, come up with some of the herbs that boost the immune system and make up a blend of those. I like to see these a little more broad spectrum than just one herb. I like to add several together so that together they do a little bit better job than they would just by themselves. Eucalyptus oil. If somebody has plugged up sinuses, sometimes they can smell that and it'll open up their sinuses and open up their nasal passageways and they can breathe again. Or if you happen to be around a campfire and you could simmer a little bit of that for breathing, it's excellent for taking in for respiratory infections, both upper and lower. Some antispasmodic tincture in a small bottle in case someone's having a seizure or an asthmatic attack. Vinegar, 4th cup of vinegar. Well, what would you do with vinegar? Well, friends, if you get a problem like, you ever had poison ivy? Well, good old poison ivy happens to react very well to vinegar and salt. You dissolve as much salt as you can into very hot vinegar and then use that as a wash if you've been exposed to poison ivy, and it will remove all the oil in and out of the skin, and probably you'll not have any further problem with the poison ivy. Some of your blood purifying herbs that you've mixed up together, like your burdock and garlic and yellow dock, some of those, some capsules of that would be good to have. And of course your salt, because we talked about the vinegar and salt for poison ivy, and also in case you might have a sore throat, that would be in order for a sore throat, for a gargle. Arnica tincture, or arnica gel, or arnica oil, depending on how you wanted to make that. It would be excellent in relieving pain from a topical standpoint. Some St. John's wort oil, very healing for wounds and also kills the pain from wounds. Some slippery elm bark powder in case for soothing for a sore throat, or if you wanted to make some pills right in your campsite. Or make some pills in a client's home Yeah, use it as your binder. Golden seal root powder, of course, that's a good old standby herb. Some capsules of that, some garlic capsules would be advisable. I like to see people take not only capsules of dried garlic, I like to see the jelly caps of garlic oil because it's excellent for dealing with earaches. Some antihistamine. Oh, I missed one. Let's go back up to our licorice. Our licorice root powder. That you would use in case that you would have some sort of an inflammatory process that you want to deal with. It also could be used by mixing it with echinacea to use in case someone would have an allergy reaction to a bee sting or something that they have ingested. You want to have some of that along. Your American crane's bill, of course, to stop bleeding, both internally and externally. Comfrey root, the root or the leaf, either one, so that you can have something for a good drawing poultice in case you have an infection process started or if you have a bruise that you want to deal with. Also, you could use it for a respiratory infection. Some decongestant herbs, maybe like thyme and maybe some vervain. Your fenugreek, of course, would be an excellent one. Help to open up your nasal passageways. Don't forget Band-Aids because they're really good at sticking little things on. Maybe you want to make just a tiny weeny little poultice for a tiny little area and put it on a cotton ball and just take a Band-Aid and hold that over the top for a very small application. Surgical tape is in order. You like to have some surgical tape to help hold things on if you need to hold some of your gauze bandages on. A stapler, of course. You can use the stapler to hold some of your poultice material together so that it doesn't leak all over you. And I would recommend having some of the underpad material in your kit as well. A jackknife so that you can cut things apart, get some of your tape off, dig out slivers, make spoons out of wood, whatever you want to have it for. Jackknives are just really, really handy. And then sometimes we have these newfangled jackknives they call a Leatherman. I mean, they've got a jackknife and a pliers and a crowbar and everything else. If you can afford the $29 or $39 for one of these, they're like a third hand. And an eye wash cup would be very handy to have in case someone would get some sort of an irritation in the eye that you could, or a foreign particle in the eye that you could be able to get it out and wash it out quite easily. And I would recommend, in addition to this, to perhaps carry along a sealed container of distilled water so that you had something good for washing both wounds and perhaps eyes out with as well. Those are only some suggestions. You can add or subtract to this as you see fit. And my only suggestion is that you don't just think this is a good idea, but you actually do it.